ebony, ivory. How does it live together in perfect harmony? You might find out on I Don't Know About That with Jim Jefferies, Jack Halleckett, Kelly Buckheim, Forest Tree Shores.
Okay, well, that's all. Jim had a stroke, so this episode's over. Tune in next week.
Jack Halleckett.
Side by side on my
Josh Halibut.
piano, Jack Halibut.
Hey, fellas.
Louise Trout and
Jack Halibut.
That's kind of a cool name.
Yeah, man.
Forrest Grouper.
I don't know. Jack Halibut? Jack Halibut, would you?
Yeah, you should
That'd be
rebrand
my new
yourself.
restaurant.
Yeah, my wife, I was watching the golf and Tiger was playing with his son Charlie. And my
Yeah.
wife goes, oh, his son's called Charlie as well. And I said, yeah. And she goes, Charlie Wood. Oh, that's a nice name. I go, he's 14, calm down. She's like, oh, Charlie
Chuck Wood.
Oh.
He's going to be wealthy. There he is. You got some dates? For,
Columbus, Ohio, Kansas City, Des Moines, Iowa.
you want to know what they are? I have them right
No,
here.
but they're all in January. Forrest, read them out.
Pittsburgh, January 14th. Columbus, Ohio, January 15th. Kansas City, January 28th. And Des Moines, Iowa, January 29th.
Woo woo.
I'll be at the Philly Punchline, January 20th. Please
Woo.
come see me. Please.
They're all selling
Please.
very well except for one gig, which is selling
Philly Punchline.
abysmally.
I thought you were talking about me.
You know what I mean? One gig, I don't know what's going on. I can't sell a ticket. It's going terribly. But
Do you wanna say it?
I'm not going to tell you which one it is. Then you won't want to come.
Okay.
Or you will, because you have a better chance of being close. I don't know. I don't know how
it's
that
all
works.
fine. No, it's still fine. Look, we got a little different thing we're doing here now because we do the Patreon. You're not going to get Jack second anymore. If you want to do it, join the Patreon where we shoot the shit. It's a bit more free type of a show. We might talk about the episode that we just did. But let's start the episode.
Yeah.
Okay, let's introduce our guest. Please welcome our guest, Thomas Rice.
G'day, Thomas. Now it's time to play.
Yes, no. Yes, no. Yes, no. Yes, no. Judging a book by its cover.
All right, so
I think you can
Thomas.
call him Tom, right?
Yeah, I agree, Tom.
Tom works.
Okay, so I think that you're a Tim Rice cover band and you wrote the lyrics for all of Andrew Lloyd Webber's musicals.
Close, but I have no musical talent at all.
Oh, he's just a lyricist. He's just a poet. That's why you bring Webber in. Okay, so all I can see behind you is a door and a lamp and a small ventilation bit at the top there. It's a heater, I assume. Curtain.
An exchange for the air conditioning.
An air conditioning exchange. Yeah, there's a thing. So there's nothing really to tell. Could I call you Doctor?
You could, but Tom works perfectly well.
But you are a doctor?
I am a PhD type doctor, not a medical type doctor.
Oh, okay. So you're a doctor of history?
No.
Oh. Can your doctorate heal people?
No.
No.
Just the doctorate itself, the piece of paper.
Yeah, no, maybe he's a thing. My psychologist thing. That's not a medical, is it? I guess it is.
It's in the realm of medicine we're going to be talking about today, though. But it's not.
It's in the realm of medicine. Are you an expert in? We've already done vaccines, pandemics, sort of thing. Is it a hot button subject?
Yes.
All right.
I would say so, yeah.
Always.
It's always. So is it vaccines?
No.
A different
No,
angle.
we're doing a different angle on vaccines.
We're running out of things.
What are vaccines a part of? I mean,
Antibodies.
no. Like a much broader topic.
Oh, medicine.
Yeah.
Well, I'll give you a hint here. What is a lizard?
Yeah.
I can't think of anything else.
I don't even know where you're. I can't help you with this. I have no idea where you're
There's
going.
a duck. There's a commercial with a duck.
Are you
Aflac.
Yeah. What's that?
health insurance.
Yeah, that's what we're
That's
doing.
it.
I got a lot of opinions on health insurance. I'm going to get myself in trouble here. Fucking hell, people get angry. I got friends who I think are smart people who don't agree with me on health insurance, So
Well, here we go. Tom Rice is a distinguished professor of health policy and management at the UCLA Fielding School of Public Health. He is a health economist who studies health insurance and international healthcare systems. Tom has written several books on healthcare economics and systems. This past year, he published a book that compares the health insurance systems of 10 countries the United States and 9 other high-income countries. And the book is called Health Insurance Systems, an International Comparison. I don't know how you came up with that title, but
I'm fascinated by this. I'm sure over the course of the podcast, you'll tell us where everyone ranked or thereabouts. But I can't see America being top of that list of top 10. That's got to be right fucking down the bottom. And if it is, I'll be shocked because I've lived in Britain, I've lived in Australia, I've lived in America, and I've got money, so it doesn't make a difference to me. But the health insurance here, they're not doing a good job. They don't know what they're doing, in my opinion.
No.
yeah, we'll see. That's your opinion too. It's not. I think it's most America's opinion, but we'll talk about it.
Oh no, not if you bring it up with this fucking accent. If you say it, you might find some allies. Not with this fucking accent. I tell you what, I'm just told to go home. If you don't like it, leave. Right now, there's someone in their car. They're going to drive their fucking pickup truck off the side of the road. Well, don't do it. You won't get any medical care. You'll just be injured forever. It'll cost you a lot of money.
Tom, you said you have a PhD, but it's not in medicine. Even though this is in the field of medicine, health insurance. So the PhD is in economics. Is that?
That's right.
Okay. There you go, Jim. So it's not always philosophy or medicine. Or history.
I can even rank you what's got the best healthcare service out of the different countries I've lived in and other countries I've visited.
Okay,
I have my opinion. I think I can get this all right.
All right. Well, let's see. All right, Tom. So I'm going to ask Jim some questions about health insurance and things in that nature. And you're going to grade him at the end of these questions, 0 through 10, 10 being the most accurate, causing a grade him on confidence. I'm going to grade him on et cetera. We'll add those together. 21 through 30, PPO. 11 through 20, PB&J. 0 through 10, POS. Which actually is a type of insurance. I found out later, too. Not just, but okay.
That's what we give the people that work on this podcast. Piece of shit insurance.
What health insurance? I mean, you know what it is, right?
Yes, it's like all insurance. It's a small amount of money that you pay to guarantee that if something bad happens to you, they can pay a larger amount of money than the small amount of money that you paid so that you'll get better. It's the same as any other insurance on anything else that you purchase in your life.
Okay.
It's coverage to make sure you're covered for a rainy day.
What was the first law passed in the United States in regards to health insurance?
Oh, fuck me. It would have been something after one of the wars. They would have come back and said, we probably have to do something with these people who have come back from the war or something. They probably did some type of government healthcare like thing then. I'm going to say 1920.
Okay.
You didn't ask the year. Was it the Affordable Cares Act? I don't know.
Okay. The Affordable Care Act.
No, that's a new one.
Okay. When did health insurance as we know it first come into existence? Like
in America or worldwide?
In general, yeah.
I believe the NHS, National Health Service of the UK, I believe that came into action after the Second World War. So I'm going to say 1945 or early 1950s, that was introduced into Britain. I don't think you ever had universal healthcare over here. I don't know how long the Canadians have been doing it, but I believe I would say similar thing after the country started having national healthcare after the Second World War. But I think there was probably talks about it before then.
Okay. There's a question that got moved here that I can't find about a young person. Why? I think I can. Why would a young person of good health?
Wait a minute. I'll tell you why I think it's after the Second World War. I'll just fill you in on why. I just watched a documentary on Charlie Chaplin. Charlie Chaplin grew up in England and everyone around him didn't have any health insurance and stuff like that. And he came up through the 1920s and all that type of stuff and then into the silent movies and everything that we know about him. And he died in, I think, the early 1970s or something like that. Okay. Anyway, but he didn't have health care in between the First and Second World War in Britain. There was illnesses. His mother had an illness, a mental illness, and it wasn't covered by healthcare. So that would be covered now. So that's why I'm using that argument.
Why would a healthy young person want to spend their hard-earned money on health insurance?
Because a healthy young person can still get themselves into an accident. They can still one day wake up and have cancer. It's something you don't want to go bankrupt if you do. If you just break a leg, you need health insurance. You have a cold, you need fucking health insurance. That's the first bill you should be paying out of your wallet, is to make sure you and your family have health insurance. That's right up there with food, in my opinion.
All right, in the United States, what type of health insurance is in the United States? Like,
it's just private health insurance that can be given to you. Mostly Americans do it through their occupation, which isn't as common as other countries. Other countries will
there's
have
no public health insurance in the United States?
You can go to emergency rooms and stuff like that and get some stuff. And there's Medicaid and all these stuff, but there's nothing good. There's nothing that you really want that's public.
So what's the difference between Medicare and Medicaid?
I don't know. I just know that it's fucking mine's about to run out and I'm going to start paying for it again.
Your Medicaid or Medicare is about to run out? Your health insurance that pays for it.
Blue whatever. This is the problem with American health insurance. Oh, you've got blue ribbon. You've got blue. What's
Blue
the
Cross.
other? Blue Cross.
Blue Shield.
You got Blue Shield. All these blues kicking about. And then you go down, I went to my dermatologist, so I've been going to forever, and they go, we don't take Blue Shield anymore. And you're like, what the fuck is the point of this fucking thing? My baby needed a small medicine, and they go, for whatever reason, the healthcare doesn't cover this particular medicine. I don't give a fuck. I'll just pay for the fucking medicine. But there's people who would give a fuck, right?
Yeah.
And it's like all the time they just put up roadblock. Now, the best healthcare systems you can use is the system they use in both Australia and Britain. I'm sure France has an excellent one as well. Canada's not as good. Okay. Canada's not as good, and I'll tell you why Canada's not as good. Because you have to have it. Doesn't matter if you're the Prime Minister to the homeless person. You have to have health insurance. You can't opt out and get yourself better insurance on top. So in Britain, you can have your health insurance, which is very good, and you can see the same doctor on the public health insurance. But if you want to see him a couple of weeks earlier and you got a brand called Bupa, right, you can slap private insurance on top. So I used to pay £50 a month for Bupa, which was nothing. And then I had private, that was just the company. I had private on top of my other one. Australia, same thing. You can have private on top of your other one. I prefer the Australian model ever so slightly better because everybody gets a Medicare card in their wallet. They can have like a credit card that has all their information. So you just go into a doctor's office, you hand over the card, and you're not filling out forms. Everything in America is, you're sick, you're feeling bad, here's fucking 15 sheets.
Okay, this is an opinion. I did just so you know, in the questions, I did write something in here, and I said rant on health insurance. This will happen for sure. So I predicted that right in here, almost in the exact spot.
Yeah,
Tim.
it really did.
All right, rapid fire. Just tell me just say what these mean. These are abbreviations.
You lead
PPO.
a horse to water, man.
PPO.
PPO.
Rapid fire.
No.
There's a gun jam.
Pay for something yourself or something.
HMO.
I don't know all this stuff. I don't know what ELOL means, and I'm a fucking comedian.
Oh, yeah. Laugh out loud.
Yeah, there you go.
Or lots of love.
Yeah. LOLZ. Okay. You don't know any of these. What percentage of Americans have health insurance?
70%.
Okay. Affordable Care Act. What's that? When did that come about?
I think that's Obamacare, I believe.
Has it been effective?
Obama, it depends who you speak to. Some people hate Obamacare because I didn't get to see my regular doctor. I had a doctor I like to see.
Why does he sound like that?
Because that's the ones that complain. They always have that voice.
Okay.
I think that it did work. I know a lot of people who benefited off Obamacare because all of a sudden they could afford healthcare and they couldn't before.
Yeah.
And then people were saying it cost them more because their other healthcare was better. People weren't happy, but other people were happy. I would say it was probably a step in the right direction.
All right. We'll ask a couple more questions and we'll come back to some of these. What is the American Medical Association, the AMA, and what is their role in shaping U.S. healthcare?
American Medical Association is AMA.
Yeah, but what is it?
What do you mean?
Okay. What was their role in shaping health insurance?
They probably police the health insurance and make sure that when because one of the big problems with health insurance is you go, I've got coverage. But at any stage, they can say to you, we don't think that treatment's appropriate. We don't think that you should do this. We're not paying for that while you have the insurance. And that's where the problems come. Because you're just like, I want to have this fucking treatment. Meanwhile, they got adverts on TV in America telling you to tell your doctor what fucking medicines to give you, and the doctor should be telling you what medicines you should have. At no stage should you go to your doctor, I just watched an ad, I think I need Liposil or some fucking bullshit.
JJ has a bit like that.
It's a load of rubbish that you should be talking. Your doctor should tell you.
Okay. On average, how much do Americans spend on healthcare each year?
Per person, so
you can do in total or per person.
When my medical insurance covers out, they're saying that I'm going to have to pay about $2,000 to keep my medical insurance at the level I need for my family for a month that I want, and so I'm going to say the average person spends $10,000 a year.
Okay. What is a charge master?
He's the bloke at the front of the army with a sword who yells "charge."
Oh yeah. Okay.
Probably called the charge master.
Maybe, yeah.
Here's a couple more questions. What's up? I don't know. Do you know what an ambulance ride would cost? Like just these.
I'll tell you this. I had an ambulance ride in Australia and it didn't cost me fucking anything. And I didn't have any insurance. I was just being an idiot at a party and I needed an ambulance and the ambulance came and got me. And then that was it.
So in America?
I'm going to say $5,000.
$5,000.
So he said, I'll tell you another one. I had a head injury in Britain. They took me into the hospital. I spent 2 or 3 days in the hospital because I was getting headaches and they were worrying I was bleeding on the fucking brain. At no stage did they ask what my real name was. And when I left, I didn't have to check out or anything. I just walked out.
It's amazing.
No form, not a single form was filled out.
I meant to ask you this.
Didn't cost me a cent.
What percentage of Americans believe the government should ensure people have health insurance? I shouldn't have said insurance.
I would say that would be 50% of the population because we all know we're divided 50-50 in this country. There's some people who say the government shouldn't have anything to do with my health insurance or whatever, and that's their big fucking gripe. But I'm telling you, people, it's the best public health care. It's the best.
Okay, and then one more question. It's up here, and then I'll ask some of these other ones. What countries have a similar system to the United States?
I don't think maybe there's some South American countries or something like that.
Okay,
maybe some South American countries.
All right.
I don't think there's anything in Europe like that.
All right, we're gonna take a quick break and read some ads, and we'll be right back.
Using the internet without ExpressVPN is like leaving your keys in your car while you run into the glass window or into a gas station for a snack. Most of the time, you're probably fine, unless the glass breaks or you go into the thing and there's no snacks and then you got diabetes and you can't get to your insulin in time. But
is this an ad?
Yeah.
Oh, okay.
But what if you come back and see someone driving off in your car? That could also be a problem.
You don't want to leave your keys in the car.
The point is, take your keys with you when you go into the
you.
gas station. And that's what ExpressVPN is like. Every time you connect to an unencrypted network, cafes, hotels, airports, any hacker on the same network can gain access to your personal data, passwords, financial data. I'm in hotels.
Yeah.
This scares the shit out of me.
Airports, yeah.
I use these Wi-Fi.
I never thought about airports.
It doesn't take much technical knowledge to hack someone. Just some cheap hardware is needed. A smart 12-year-old could do it.
Oh, crap.
What about a dumb one?
I couldn't.
A smart 12-year-old or a regular 14-year-old can do it. Your data is valuable. Hackers can make up to $1,000 per person selling personal information on the dark web.
And we know how we feel about the dark web.
Oh,
don't get started. Let's just move on. Move on.
It can't be a good thing.
Move on.
ExpressVPN creates a secure, encrypted. She'll probably say, "Oh, the dark web's helping that person." ExpressVPN creates a secure, encrypted tunnel between the diverse and the internet. Hackers can't steal your sensitive data. And fun fact. I'd take a hacker.
It would take a hacker.
It'd take a hacker. I'd take one too with a supercomputer over 1 billion years to get past ExpressVPN's encryption.
That's pretty brilliant.
I feel like ExpressVPN are throwing the gauntlet out there. Go, you get your supercomputer and see.
You should know a thing about hacking too.
Oh, I played a hacker on TV. Thirsty work. Jack set it up for me and my devices because I wanted to see if he knew how to do it.
Smart 12-year-old.
Very smart 12-year-old.
Yeah, my phone, computer, iPad. Every now and again, I just looked at him going, a 12-year-old could do this. Everything which is questionable, considering hack is his last name. Woo. We'll see how it goes.
That joke got butchered.
Secure. No, I read it good. Secure your online data today by visiting expressvpn.com/I don't know. That's expressvpn.com/I don't know. And you'll get an extra month or something. They normally give you 10% or some crap like that. What? You'll get an extra 3 months for free.
Yeah.
expressvpn.com/I don't know. What have you got to protect? Is that someone else's slogan? I just is that another company?
That's great. I'm sure they're going to use that now.
Okay, Tom, on 0 through 10, 10 being the best, how did Jim do on his knowledge of health insurance?
Well, I would say he did 9 on the forest and about 5 on the trees. So I'll give him about a 7.
Yeah, I like that. Yeah, I don't know the finer points, but I know the big picture.
Yeah.
9 on the forest and 5 on the trees. I don't know if I've ever heard that, but I get it. All
Yeah.
right, cool.
Yeah.
Confidence, how do you do, Kelly?
I think probably about a 6 on confidence.
Do you call your penis a tree?
No, I don't.
That would be
You
nice.
should.
Yeah, you're a forest.
I don't think any women would like that at all.
You're the mighty oak. How about that?
Mighty Oak, maybe. I don't know.
The weeping willow.
That's after whiskey.
It's not going to help. So that's a 13 total. I'm going to just give you a 5. You have 18. PB&J. You like peanut butter and jelly?
I don't. I've never eaten one.
All right, I'll give you 10. So you're
What?
PPO.
That's
Just
going on
wait, wait.
Patreon.
I've never eaten. I've
I'll make you
had
one.
a bite. I just.
What?
It's stupid American thing.
Shut the
putting
hell up. You and
peanut
your-
butter with
Oh,
jam.
you eat
on it.
Vegemite
Oh,
and
yeah,
with
Vegemite's
cheese
dog
and
shit. It's dirt on bread.
Wow, Jack is very upset. Jack is very, you can't see Jack, Tom. He's off camera. Jack is very fired up. This
Wow.
You don't know him, but this is the most fired up he might
I
have
think
ever been.
if I was offered a peanut butter and jelly sandwich as a child, it would be something I ate. But as an adult, I can imagine what it's going to taste like. I'm fine.
Peanut butter and honey?
No,
That's a
no,
great sandwich.
no.
No.
I've had peanut butter sandwiches. I think, no.
We're going to make them.
All right. Well, this is on the Patreon. Okay, Tom. So what is health insurance? Jim said, yes, it's like all insurance. Small amount you pay to guarantee if something bad happens, it'll be covered. I think that's
pretty.
He got a 10 on that one. That was perfect.
all forest and all trees.
Yeah.
What was the first law passed in the United States in regards to health insurance?
He said after a war. Actually, that wasn't true. It really was around the mid 1960s when Medicare and Medicaid started. So we were quite late to the game. The first health insurance law was in Germany around 1890. But I think he was right in saying that in terms of universal health care coverage, the NHS in England was among the first, and that was around 1948. So in that respect, he was right. But the U.S. didn't get to it until much, much later. And we still never reached universal coverage.
I meant to ask this to you too, Joe. So before health insurance, what happened? Like if a doctor saw you, like Jim, what do you think?
You just paid for it, I guess.
Yeah, I mean, is it just was
And
like
you
pay out of
died
pocket
and-
thing, or is that all it was?
There's no magic to it. You just paid for it. If you didn't pay it, you might be able to get your church to pay for some charity care, or you might more likely go without it. One interesting thing is that before 1965, half of people in the U.S. over 65 had no health insurance. So it was a really big problem.
Right.
Wow.
Wow, I never. And so
And
I
they
guess,
didn't even have GoFundMe back then, which
Yeah.
is now healthcare.
Yeah, you had to be religious.
Yeah, damn.
when did health insurance, as we know it, first come into existence? Is this the same kind of answer, basically?
Yeah, this is the
That's
NHS
the
one.
answer, yeah.
Yeah,
Oh.
that's a different answer.
Oh, okay.
See, that's what you learn out of Chaplin documentaries.
Basically, it started in the 1930s in the United States when hospital insurance formed in one of the Blues, Blue Cross, and then in the 1940s, Blue Shield for physician coverage. So it goes back basically to around 1930. It's just that a lot of people didn't have it until fairly recently.
So I imagine, like, if you went to war in the Second World War, where before we had universal health care anywhere, I reckon that'd be a good way to get few of your ailments fixed. Because the army,
In the war?
the army would have taken care of you. It's like your joke you used to do about you couldn't afford health insurance, so you crashed your car, and then you go, "All right, I got lupus. It must have happened with the airbag." Remember that game?
Yeah, that's it. That was pretty close. That was the one I did with Conan. Check it out, everybody.
one of the government programs is the Veterans Administration that covers veterans, and they've had that for a long time. And it looks a lot like what you might think of as socialized medicine. The government provides everything. So it's one example, and we'll talk later, I think, about socialized medicine. The U.S. actually has some of it, and ironically, it's for former military people.
I think part of the problem with trying to sell healthcare to Americans is the word socialism. A lot of Americans hear the word socialism and their brain goes straight to communism, and they don't seem to be able to wrap their head around it. And, as someone who came from a socialist, and right now I'm going to get people going, "Whoa, what happened to COVID? You were not there. Shut up. You don't know what you're fucking talking about." But socialism is a bit of a dirty word. I think we need to change that word and we call it the government givey program or something.
Mm-hmm.
You know what I mean?
Govey gives.
Govey gives.
Govey gives.
Yeah. And get some mascot who's like a panda that's dancing or something next to it. You know what I mean? So that we can soften it up.
But doing this with the money.
Yeah. The government's like this. Boom, 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 making it rain healthcare.
Is socialized medicine a bad word, do you think?
Yeah, socialized medicine is generally a bad word. We usually talk more about universal coverage. I mean, the UK system is probably the closest of the major Western countries to have it. And it's even not socialized medicine for one reason that Jim mentioned, which is some people have private coverage to top off, but also technically the doctors don't work for the government. But when you think of socialized medicine, it's sort of like the old USSR, which is the government owns everything and the government runs everything. And markets are involved in lots of aspects of healthcare systems, even in the UK. So it's probably not a very good term to use because it's not very accurate.
Yeah, it's not, because the ones in Britain, the ones in Australia, it's like you can be like a doctor that takes, that gets the government money amount. Or if you think you're starting to excel as a doctor, you can go up and then you can be a doctor who takes private patients as well. And so you can earn a bit more coin that way. So it's not restricting capitalism in any way.
Right.
Okay. Why would a healthy young person want to spend their hard-earned money on health insurance?
Well, I think that there are probably three reasons, and Jim got the most important one by far, which is you don't want to go bankrupt. It's said that about 2/3 of personal bankruptcies are in part due to medical bills, and that's the main thing. He said you can break a leg, you can be run over by a car while you're texting as you cross the street. You can get cancer, and he mentioned that as well. So that's the main reason. I think there are a couple other reasons you might want to. One is to go to a better, higher quality, less crowded facility. If you don't have insurance, you're probably going to have to go to a community health center. You're going to have to go to the emergency room in the hospital. You're probably on average not going to do as well if you have to do that. And I would say the third reason to have health insurance is that if you don't have health insurance, you might get this ache or pain and say, oh, I just can't afford it. I'll live with it. It might be very dangerous. You might not be getting, the cancer test you ought to be getting. So health insurance makes you feel more confident that you can afford preventive care. Yeah. So that would be another reason.
Is this, and it's the same with car insurance. It's like when you take your car into a mechanic and you've had a fender bender and they go, are you claiming this on insurance? And then you go, yeah, and they're always like trying to cut you a deal. They're always like, all right, if you're claiming insurance, I'll do this and we'll throw in that or whatever. Then if you're paying for it yourself or you're paying out of pocket, all of a sudden the price is 1/3 of what they're charging the insurance companies. Now, you always feel like, oh, bargain, I'm getting it for cheaper or whatever like that. But these hike up our insurance policies and our no claim bonuses and all that type of stuff. Whenever I go to a doctor in America and I have a procedure, I find the only doctors who give you an honest price in America are plastic surgeons because they can never be covered by insurance. It's elective surgery, so they have to go. A set of tits costs 20 grand, 8 grand, whatever it costs. That's what they cost. But sometimes you break your leg in America and all of a sudden they go, it's $40,000. And they just give these outlandish, and then you go, I can't pay that. And they go, okay, 15? Yeah. It's like, it's just, shouldn't there be at least a government body that puts a price margin on how much procedures can cost? Or is that just, am I just talking rubbish?
So that's what pretty much every other Western country does, except the United States. They have a fee, and the fees are known, and they're probably about a third of what they are in the United States. So it's not rubbish at all. It's just something politically we've never been able to do. But one thing I want to say in your response is that it's kind of ironic, but it works a little bit the opposite of what you said in healthcare than it does in auto, which is if you have insurance, you're probably going to be paying about a third of how much the price is going to be about 1/3 of what it would be if you're not insured. So because your insurance company cuts these deals with the insurance company, if you're uninsured and you go into the hospital, they have no incentive to deal with, to cut you a deal. And so ironically, it's the uninsured who face the higher rack rates.
Oh, right.
And the insured people pay much less because of these deals their insurance companies cost. So the people can afford it least are the ones who are charged the most.
Yeah, when I ruptured my Achilles, I had no health insurance. I had nothing. And I went to see an orthopedist in Miami, and they actually negotiated with the anesthesia. It was all outpatient anesthesiologist, the surgery place, and they negotiated all these prices for me. Otherwise, I'd have been screwed. And it was like, I remember getting a bill from the anesthesiologist, and it was like $12,000. And I was like, what the? And I just sent it. I called up the orthopedist, like, oh, we'll take care of that. And then it was like, oh, it's like $1,000 now, or $2,000. I was like, what? It's the same thing.
Well, that's how this country's set up with so many. It's like, it's so expensive to be poor here. And like, you think of all those like payday loans and all of that stuff. It's just all predatory shit that people that don't have money end up paying more. And like when people talk about these rich CEOs, like we need to go to them to talk about money management. I'm like, I want to talk to the single mother of 5 kids who's somehow made things stretch because obviously they're much better at budgeting than fucking rich people. Yeah. I'm angry about rich people.
Jeez, calm down.
Hey, rich people.
What? Well, okay.
Tax the rich.
What type? I said, what type of health
insurance?
insurance?
Leave them alone. They're doing their best.
I said, what type of health insurance is in the United States? Jim said, private, but then I asked him about public. He said Medicaid. He thinks I asked him the difference between Medicaid and Medicare, and maybe we can talk about public, private, United States.
Yeah,
Medicare,
they're the trees, man.
Yeah, no, he was. I don't know if I'd call it the trees, but that was the one thing that he really got wrong. I'm afraid. Sorry, Jim.
That's all right.
Because you said that there's nothing good about public coverage, and that's just simply not true at all. So there are actually more people have public coverage than private coverage in the U.S. And well, that's not true. It's about half and half. The public spends more. So there's Medicare, and that provides coverage for people 65 and over and the disabled population. And people love it. It's a great coverage. That's what people didn't have before.
So when we turn 65, we all get free healthcare in America?
No, it's not free healthcare, but it pays for a large portion of the healthcare. And it's a very popular program that it's hard to imagine living without because older people have so many health problems. Now, the even bigger program in terms of number of people, it's almost a quarter of the U.S. population now, is Medicaid. And that provides coverage to people who are poor or in most states, but not all states, near poor. And that's a lifesaver. About half of births in the United States are covered by Medicaid now. So imagine if we didn't have Medicaid, we already have the highest infant mortality rate in the entire developed world. Imagine what it would be if we didn't have Medicaid.
Oh, yeah. I was thinking that the other day. I had a baby, and they're not cheap to bring into the world. I was thinking, how do poor people fucking bring these things in?
Yeah, and that's the big problem too with the abortion laws. It's like, okay, we don't have universal health care, and you're forcing people to birth children that they can't afford, and then wondering why crime increases or, depression or suicide or any of those things. It's all related.
Yeah, we should mention abortion. That'll really not split the room.
That's part of healthcare.
So Medicaid is not the greatest thing in the world because it doesn't pay providers very much. It only covers poor and near poor people. However, it allows people to have a regular source of care, and it means they don't have to go through the emergency room for things. So it's something that I think we should feel pretty good about. It's just a shame that 12 states haven't taken up Obama's offer and covered a whole lot more people through the Medicaid program. And some of those states have a whole lot of people like Florida and Texas and Georgia and North Carolina. So the people who live in those states really are screwed.
I'd be happy to change it to Trump care. It wouldn't bother me in the slightest. Call it whatever president you're having at the time.
Yeah, what is that? So there's some people like I know a lot of people that the Affordable Care Act has helped. We can jump ahead to that too, and then there's people like, it's ruining it. It's made prices go up, or it's more expensive to have it. I mean, what's the controversy there?
Yeah, the only thing I've heard is I haven't been able to keep my doctor, and I don't understand that either. What's going on?
Well, under the first of all, the Affordable Care Act did not change most people's health insurance. Okay. People had employer coverage and people had Medicare, which is, probably 80%, and people who already had Medicaid, which is probably 80% or more of the people, they didn't have any changes. What the Affordable Care Act did is people who didn't have those types of coverage now could get coverage more affordably. Basically, it was individual rather than group coverage that was subsidized by the government. And the subsidies now are pretty good. For an individual, they go up to about $75,000. You can get some sort of a subsidy. It's on a sliding scale. For a family, almost up to $150,000 under Biden. So basically what the ACA did, or Obamacare did, is it made individual health insurance more affordable for people who didn't have it. And as a result, the uninsurance rate in the US, which is zero elsewhere, went from 18% to 10%. So it actually had a big impact. From what I can tell from the literature, it didn't have any impact on prices.
Okay. So it's just like propaganda.
And so the people who don't like it, they're just anti-Obama, or is there anything else not to like about it?
Well, I don't really think so. So keep in mind that when the Republicans controlled the House of Representatives, they voted 50 times to abolish Obamacare. So it was a political thing. It was a Democrat versus Republican thing, basically. And it hasn't changed very much since then.
But why would any Republican, I don't want to get into the Republicans bad, Democrats good type of argument,
right?
But why would anyone follow the Republicans if they were going to take their health care away? What was the scaremongering? What did they say?
The scaremongering is basically everything government does is bad. So we don't want government more involved in healthcare.
So the Republicans' whole thing is this: don't listen to us. Yeah. You don't want anyone in charge. Vote us in and we'll do nothing.
Well, and so much of the information that people get is from like Facebook or something like that. So they'll see one anecdote where somebody's like, well, my bills were so much more expensive. And it's really just that person had heard somebody else say it. And then they changed the narrative a little bit. And then those things travel. And then all of a sudden you've got all these people going, well, it's so much more expensive than I used to pay. And like nobody's shown a bill.
Now, when you wrote the book and you ranked all the different health care, this is obviously, okay, so it's partly, I guess, your opinion, but what did you base your opinions on to make these rankings?
So what I did is I looked at about 70 different measures, I think it was, of outcomes and equity and access, and made a subjective determination. And I didn't rank them 1 to 10 because I think that some are better in some ways than others. We can talk about that as we go on. But so the 10 countries I had, if I can only remember them in alphabetical order, were Australia, Canada, France, Germany, Japan, the Netherlands, Sweden, Switzerland, the UK, and the US. And the US was by far the worst of the 10 countries.
Right.
And if you also look at popularity, opinion polls, the Americans hate their healthcare system way more than other countries. If you ask them, should the system be completely dismantled and start from scratch? All the other 9 countries, less than 10% of the people said so. In the US, it was, something like 30%. My 2 favorite of my 10 countries were Germany and the Netherlands. Interestingly, the government isn't that involved. You have sort of private nonprofit bodies. You have groups of insurers negotiating with groups of providers, groups of hospitals and doctors. Prices are lower. There are no waiting lists at all. Everybody's covered. Prices are manageable. So those happen to be my favorites. And, we can talk about Australia and the UK as well.
No, but I always heard that the European countries were better than the Australian and the UK one. France is... We did a thing on the Jim Jefferies show. The France, is it true that they give you an extra bed for your partner to sleep in when you're in hospital?
I would not be surprised. I think they send doctors to your home. When you have a baby, they give you all sorts of financial resources. France has a very good system.
I'll give you an example that just happened to me. Right, so I had a baby. My baby was born premature, so it wasn't like the strongest of babies ever. We had 2 nights in the hospital, and then they send you home. Good luck, right? My brother had a baby 2 months later, and in Australia, full-size baby, not a complication, right? They left after 4 nights, and they could have stayed another 2.
Wow.
Right? They could have stayed another 2. But in the American one, they were like, it was like when you don't even get a late checkout. They're like, out you get, bloody midday, get out of here.
Yeah. And if you look at the international data, Australia has really excellent outcomes, health outcomes compared to most other countries. So it does look really good there.
Not when it comes to skin cancer. You're going to have a bit of ozone layer. We're fucked over there.
Here's one that this always confuses me since I've been alive. There's a PPO, HMO, POS, EPO.
Since he's been alive, year 1, Forrest was thinking about
it. Yeah, since I was a little tiny kid. I came out of my mom's vagina. What's that? Is it PPO, HMO?
There are only 3 that you really need to pay much attention to. 2 of them are pretty obscure terms. But think of it this way. We're going to leave HSAs. Know what that means in a minute to the side. We'll talk about PPOs and HMOs, which Jim didn't know what they stood for, but if he is born in the US, he probably would have, because they're pretty much part of the language. Now, PPO is a preferred provider organization. HMO is a health maintenance organization. There are 2 big differences. Okay. The big differences are, do you have to stay in the health insurer's network, or can you go out of the network and pay extra? That's one difference. The other difference is, do you need a referral to go to a specialist? In an HMO, you have to stay in the network. You need a referral. In a PPO, you can go outside of the network, you pay more, and you can go directly to a specialist. You don't have to stay in the network. And then these other ones, EPO, POS, really is a term. They're sort of hybrids that are in between. The health savings account, the HSA, is important because I think a lot of young people have these, in part because it's the only choice their employer gives them. And these are like personal checking accounts for your healthcare bills. And they're tax favored in a couple ways. The first way is the part you pay is from pre-tax income. So you don't have to pay income tax, federal, state income tax that. And the second is the money you accumulate in these accounts, the interest that you get, the growth is tax-free. So they sound like really great things, but the rub is that they have to have a very high deductible. And a lot of people either don't want a high deductible, or if they have a high deductible, they'll avoid services that they ought to be getting. But that's what an HSA is.
Well, the deductible does my head in as well, because so often, I don't know, medicine to medicine. Sometimes you get a medicine and you'll go down to your CVS and you'll go to get it, and they'll go, this one's not covered by your insurance, or it's partially covered by your insurance, and you have to pay $20-something on this or whatever. And there's always, even at the doctor's office, there's a $10 copay that goes along with the whatever. And I'm like, they could say anything to me when I walk up to the counter. I don't fucking know. Tell me it's $600. All right, I'll fucking play. Now, when Kate, my ex, was pregnant with my son, we were touring the UK one time, right? And she was about 7 months pregnant. And she had to have some root canal surgery, like proper dentistry had to be done. And we were in Liverpool, I remember, right? So we took her off to the doctor. And then they looked, this is emergency root canal. We got to go straight in there. They did the whole thing. I said outside. She came out, and the girl behind the counter was like, so are you a UK citizen? Are you a resident? Are you fucking anything? I don't know. And then she went, no, I'm from Canada. I'm just here for a couple of weeks. And then they're like, well, there'll have to be a copay because you're not from around here, right? And we were like, fuck, they're going to go for us here. We're bloody tourists without insurance, right? And they go, she goes, $12.95. We went $1,295. No, £12.95. And I was like laughing, like, really? I would have to pay that with my insurance in America. They'd find some extra add-on for root canal that I'd owe them $50. It's like, so I never understand why people who are traveling to the UK, because Australia, you have to be a citizen. You have to be a resident. I can't get healthcare in Australia right now because I'm not a resident of Australia. When I go back into my things, I have to get insurance, right? But in Britain, why you would ever buy travel insurance to go to Britain? I would go there just to break my leg.
You'd go there and then break your leg.
Yeah, break my leg because that's the place to
you just drag it into.
Or if I have a broken leg, I get on the plane, and then I fly over there. I just got it at Heathrow, and then they'll fucking fix it for you.
Well, and the root canal thing is like dental care is not even included in a lot of health insurance.
The government £12, £13.
Maybe this would be for you, but it's not true for everyone going to England. Theresa May, before she is prime minister, when she was in parliament, said out loud on paper that she wanted to create a hostile environment for immigrants who wanted to come to the UK. So they were not given a very nice situation. Immigrants who tried to come under the.
This is before Theresa May. This is me milking old Tony Blair. This was back in the day. He didn't give a fuck.
So these copays and the paying 10% and all that actually happens in other countries, particularly for dental care and for prescription drugs. What's really unusual about the U.S. and what stinks is how big our deductibles are. You can have a policy with a $10,000 deductible. That means you have to pay $10,000 in a year before the insurance pays anything. No other country has anything resembling that. It's a uniquely American thing, really, really big deductibles.
Yeah, a lot of your insurance here is just like you're just getting insurance for cancer.
Mine's called the catastrophic plan.
Is it?
Yeah.
That's the name of it?
Yeah, it's a catastrophic plan. It's an $8,000 deductible.
This is what Nugget Productions offers.
Well, Jack, stay safe.
I'm trying.
That is the technical name for it. Catastrophic plan.
The catastrophic plan.
Yeah, and then there's people, and you're talking about going to other countries. I know there's like medical tourism. Because there was a question there I didn't ask, but dental insurance isn't even included in that insurance. No. I remember when you sign up, you're like, oh, do you want dental too? Yeah, of course I want dental. And then that's like a different insurance.
Different website.
And then I know a lot of people that go to Mexico and get like
do
dental
I
work.
Have dental? Jack?
Your insurance covers both.
Oh, good.
WGA, the Writers Guild insurance was awesome. I don't have it anymore, so I had to go back to this LA
covered California.
Covered California, and it's like, oh, good luck. And dental, it's like I don't even have dental now. So
yeah, a lot of countries don't actually have dental insurance. In the U.S., most people have it, but it's very thin coverage. I'll give you my own example, and this is from a while back. My kids are in their 30s now, but when they were in their late single digits and early teens, they needed orthodontia. We had Delta Dental. And back then, so this is, 25 years ago, I think, the orthodontists are smart. They get you twice. They get you when you're about 8 to make your jaw bigger. They put on these torture instruments to expand the jaw. Mm-hmm. And then they get you in the early teens to give you braces. And I think that each costs like about $7,500. So we had to pay $15,000 per kid. The lifetime maximum per kid was $1,500. So in other words, my great Delta Denta paid about 10% of my kids' orthodontia.
God.
Yeah, no, I don't trust all dentists in like that, man. I just feel like every kind of meat now is getting Invisalign and all this type of stuff. I feel like they just tell you something's wrong with your teeth. I mean, says me with my fake teeth.
Well, Jack had Invisalign and his teeth are great now.
I had like a month left. I had braces when I was, but the other thing about dentists, they all think they're funny. Every dentist is always hey,
they've got their hands in your mouth and they're asking you questions like I can't respond.
I was going to be a comedian too. Laughing gas.
Yeah, pretty much my health insurance plan is put everything off until I'm rich enough to deal with it, but I'm still waiting on the get rich part.
Yeah. That one's easy.
My teeth are gonna fall out.
Yeah,
for sure.
Okay. Oh, American Medical Association, AMA. What is their role in shaping U.S. healthcare? Like, what is that? What are they about?
Yeah. So Jim was sort of kind of the opposite of right on that one, which is they don't really police health insurance. The AMA represents doctors, but there's a couple of things there. First of all, it used to be about half the doctors were in the AMA. I just looked it up, and only about 15% are now, because the rest of them either don't believe in the AMA or they don't want to pay the dues. And the AMA historically has called any government in the like 40s, they were the ones who called Harry Truman's plan for national health insurance, socialized medicine. And they attacked Medicare in the 1960s, tried not to make it happen. So they've always been pretty right-wing in their viewpoints. Well, anyway, it turns out they made out like bandits with Medicare because they weren't going to support it unless they got a good deal. They got a great deal. They became pretty rich off Medicare. And now I think they kind of like it, but they've traditionally been a very conservative, politically active lobbying organization. So that's what they look like. And so I'm at a university at UCLA, and a lot of the physicians at UCLA believe in national health insurance, and they're in like a different medical group, the Physicians for National Health Plan. So there are various competing groups. The African-American physicians, many of them joined a different medical group. So the AMA doesn't in any way represent all physicians, but they certainly get the most visibility. And they have a famous journal called JAMA, the Journal of the American Medical Association, that gets on the news some. But anyway, that's what the AMA is.
Yeah, it's one of those things that you think would be like, all right, we want everyone to be, and it seems like they're always jamming it up, or like the front league, you said jam, I just said, but they're always mucking it up.
Muck's also a good journal.
Mucking it up, Muck Journal. Here's two questions that are kind of simple. What percentage of Americans have health insurance, and then like what percentage of Americans believe the government should provide health insurance?
70%, but
you said 70 have, and 50% of Americans think the government should provide it.
Yeah.
Well, that would be pretty grim if it were 70. Before Obamacare, it was 82%. Now it's 90%. So 9 out of 10 people. But, pretty much everybody has it in other countries. In terms of the percentage of people who think that government should make sure everyone has coverage, Jim said 50. He was close. It was 60% of Americans say they think government makes sure everybody has coverage.
But you can't bring it up. Well, if you bring it up, people get very, very angry.
I know, it's so weird. It's like,
people get very angry if you bring up just the concept. Like Bernie Sanders talked about it all the time, and people thought he was a communist.
Yeah, and I had a friend he's Republican, and he was like, he was just like against what you would, the term socialized medicine, but universal health care or something like that. And then he had a very close friend that got sick, didn't have health insurance. And then they started a GoFundMe. And I'm like, there's a solution here.
That's the problem. People don't care unless it affects them.
Yeah. Well, my friend, Dr. Drew, who's a famous doctor, he told me that socialized medical care never works in any other country, and America's got the greatest system on earth.
He's part of the AMA.
He's one of my favorite people, man. And I was just like, dude.
Come on.
I can't, but that's his way. His brain's wired about this particular subject. So it's a lot of, everything's conditioning. It's what you grow up with. Where did Australia come on that chart? I can't imagine it was number one, because Australians bitch about their medical health care in Australia as well. The British are dead proud of the NHS. They're always carrying on about how good it is. But then also, this is a card that the British do, right? Because they're all paying money into the healthcare like this, they'll do things like every smoker costs the NHS £50,000 in their lifetime. So it turns the public against you as a smoker, because they're just like, you're costing me money. the taxes like that, right? Which they never mention. Every smoker spends $120,000 in extra taxes in a lifetime because of what the government put on cigarettes. Like they pay for their cancer, leave them alone. But so there's a lot of that. But the Australians do this whole, this bloody medical fucking thing, this country's stuffed. Australians are big fans of saying the country is stuffed and then saying afterwards, but it's the best place on earth, right? That's like, there was a sketch in a TV show back in the day they used to do that. That's a real Australian thing. This place sucks. You wouldn't want to live anywhere else. So where did Australia rank in that?
Well, so actually, it was interesting you said that the Australians are complaining more about the Brits. So I was looking at my book, and it has a table about how many people think the system works pretty well and only needs minor changes? Both Australia and the UK were 44%. So people seemed about equally happy with the systems in the two countries. Australia ranks really good in keeping people happy. The way in which Australia looks worse than the UK is it's a much less equitable system. And the reason it's more equitable, you kind of mentioned earlier, which you can top off things with private insurance. In the UK, only about 3% of people top off or 5% top off. In Australia, 50% do. The people who get private insurance, half the population, they wait half as long to get procedures as the people who don't get the private insurance. So Australia is less equitable. Plus, they also have the Aboriginal problem as well.
Yeah. Well, that's a whole other podcast that we're not willing to do. There can be some other podcast. I don't want to get involved, but there's a few things that people think that with the Aboriginals who live in rural areas, then it'd be cheaper just to move them into suburban areas than because they have to fly out planes with doctors and nurses and stuff, and the taxpayer pays for that. And by the time they pay for that, we could just house them for half the price, right? And so, and then as a prime minister, he said, if these people want to live this lifestyle. He called Indigenous Aboriginals living on the land a lifestyle choice, right? So that was a bit of a bad sort of foot forward.
Don't get me started on the gay Aboriginals.
So that's a very delicate. And I understand both arguments a little bit on that one as well, because it's like, why are we spending so much money when we could, But anyway, we're not going to get into that. What are we talking about? Someone change the subject real quick.
What countries have similar systems to the United States? Jim said he doesn't think anyone does. Maybe someone in South America.
Yeah, he's right. So the reason that we're an outlier in two ways. One is we don't offer universal coverage. The other is we spend way, 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 way more than other countries, even though our outcomes are worse. Our access is worse. So those are ways in which we're different. But if you want to talk about countries that bear some resemblance to the U.S., as I mentioned, Germany, the Netherlands, and Switzerland, they all have a lot of private insurance. But the key difference is that they're not for profit. So basically, the role of their insurers is to pay bills. What do our private insurers do? Well, they're owned by corporations. Corporations are owned by shareholders. And so the motivation, we learned this in basic economics, is to maximize shareholder returns. Mm-hmm. And so what, an insurer is really motivated to do here is to, maybe not pay bills. And so that makes the U.S. really different than other countries. There's just a much greater it's not that corporations aren't involved in medicine in other countries. Corporations aren't involved in health insurance in the other countries. What they do is that private insurance is involved in the wraparound. They're not involved in the core insurance. And I think that might be the thing that really makes the United States unique.
When you said those companies are non-profit in Germany, in the Netherlands, so who owns those companies? Is it just somebody charitable who just wants to help everyone out, or are they government-owned private? So how are they?
So they actually, you wondered how far health insurance, Forrest asked how far health insurance goes back. Well, it actually goes back to the Middle Ages in a way. It's the guild system. So these were basically workers' guilds that tried to provide some support for, it goes way back to when a guild of workers wanted to provide support for, say, a widow whose husband died on the job. Mm-hmm. And these formed through these sort of nonprofit groups. And so employers were involved. So it's really more of a consortium from the employers and the employees, and now the nonprofit companies. So for-profit was never involved in this. It was more something that was on the job that became institutionalized as their national health insurance programs.
No, but of course they could turn a profit, right? They might not be for-profit, but if they get enough premiums coming in and people have a healthy year, maybe COVID is a down year for them, but what happens if there's a surplus of money? There's just stay in the company to make the company better, or?
It depends on the country, but I think that what would happen in a country like Germany is that they would then lower the part of your paycheck that you have to pay each paycheck for health insurance, because I know that they have to raise that part of the paycheck. In fact,
Boris just reeled back in shock.
I'm just like,
so basically
We're number
the goal.
USA number one.
So the goal in a place like Germany is to try to control healthcare costs so people don't have to pay more out of their paychecks to pay for health insurance.
Wow.
Yeah.
And so Americans spend how
That
much?
wasn't Hitler who brought that in by any chance, was it?
So I don't want to talk about that.
On average, how much do Americans spend on healthcare each year? Jim said each person spends around 10 grand.
Yeah, he was close. It's about $12,500. But younger people pay way, way less, and older people pay way, way more. But Americans spend on average about twice as much as your typical Western European country. About twice as much as Canada. So way, way more here.
And then these were some of the things, like an ambulance ride. He says was like 5,000. I didn't ask you how much an MRI or a bag of ice in a hospital is.
I'm about to get an MRI on my shoulder tomorrow.
How much is an MRI? Do you
I
think?
don't know. I reckon an MRI is going to cost me $3,000 just to fucking be in the machine.
Yeah, I don't know. I have no
I think
clue.
I looked it up, and the average is about $1,250, but it varies from hospital to hospital. So it actually helps to shop around for that sort of thing, because your insurance may not pay for the really expensive ones.
And that's
you
like,
shouldn't have to shop around.
Yeah, I know.
You're already worried about being sick.
I've got a coupon here for my MRI.
Well, that's it. You asked the cost of an ambulance, and there's so many people in this country that will turn down an ambulance ride when they really need one because they're like, I can't afford that.
And what price was it?
I've heard that they're around like $1,000, but I don't know.
Mm-hmm.
Is that correct?
Yeah, I looked it up, and it looked like a typical average varies between $500 and $1,200. I think it depends crucially on whether it's a private firm that runs the ambulance company or whether it's like, your fire department.
Right.
Yeah. And the charge master, we've kind of touched on that a little bit. Jim said the bloke in the front of the army who yells charge. That couldn't have been right.
Yeah, he didn't quite know that, but that's all right. It's a very obscure thing. It's basically a list of thousands, if not tens of thousands of rack rates that a hospital claims that charges, but it only charges that much to uninsured people. It charges less to insured people.
What fucking
deal.
I'm depressed.
Why do they do that to the why do they do that? What is the benefit of doing that to the uninsured?
The benefit of doing that is to try to maximize profits.
Yeah.
Yeah.
I know, but why don't they maximize it with the insured? Because the insurance companies don't put up with that shit, I guess.
And the insurance companies have bargaining power. They don't put up with that.
Well, let me ask you this then. So is this
Like the undercoding. What is that?
It's under the code.
We've gone through most of these, or I think all the questions that we asked here, but do you think, your personal opinion, do you think in the United States we will come to we'll move up those ranks that you did, or we'll come up with a system that's closer to something in England or Australia or Germany, like where it's, what do you think?
Have they ever given universal health care a go here? Has there been or is Obamacare the closest?
Obamacare is the closest. That's exactly right.
And I think what Forrest was saying, do you think we'll ever give it a go?
Yeah, I don't, not for a long time. I think that, we had Obamacare was a good opportunity. We cut the uninsured rate about in half. I think we might make more progress on getting more people covered. But in terms of controlling costs, I don't really see tremendous progress being made there. For example, in Biden's efforts to try to deal with prescription drug costs, that was dropped from the bill. The bill that Joe Manchin just killed. That wasn't even in the bill because politically they couldn't have that. Dental insurance was supposed to be in that under Medicare. That was dropped from the bill several weeks ago because politically they couldn't get there. I think politically it's going to be very hard to do anything that cuts costs, because the way to think about it is, and I didn't make this up, that $1 of cost savings is $1 of somebody's profits. So, it's really hard the way we have our political system here to try to cut costs, because you're cutting profits and there are an awful lot of special interest groups there. So I think that we will make better progress on coverage eventually. I don't know about costs. One thing that we're making good progress on is delivery of care. I think we're providing better care. And I think that we'll probably improve in the rankings somewhat. but it's going to take a long time because we're so far behind a lot of other countries in treating curable illnesses.
Is there a third option? I remember Mark Cuban told me when I interviewed him, he said something about like
you were name dropping today.
No, well, that was on the TV show, Mark Cuban, because I said, what would he do about healthcare if he became president? He said, he said something about you would put money into a thing and that would be a pot of money and then your surgery would come out of that and the pot of money would rise up. And if you went over, you could have a payment plan so that everyone's sort of still paying for their healthcare, but as they need it.
Is that like an HSA kind of thing?
It sounds like an HSA, but what Jim's describing sounds like something that's not an individual account, but that there's some sort of collective aspect to it. And I'm not aware of Cuban's proposal in that regard.
Yeah, because
look, I might be getting it wrong. So watch the interview.
But I used to work for the county government in Florida in Dade County, and I remember they were self-insured is what they would call it. So when we were driving our cars. So anything like they would put money each month into this pot, and if someone got into an accident, that's how they would do the insurance. So maybe it's something like that. But.
Because the theory is with insurance that most people pay more for their premiums than they do for their medical care in their lifetime. It's the same as cars. Otherwise, these companies would cease to be companies if they weren't turning a profit. Is it sensible of a person to back themselves and go, all right, rather than give $1,000 a month to this company, I'm going to put $1,000 in a bank and then I'm just going to take my medical care out of this bank account that I keep putting it into and hope that I have a good 5 years where I don't get sick and then on it's all just gravy. Am I talking lunacy right now?
It's putting a lot of people in great jeopardy if you were to have everyone on an individual account. So I would like, the way you defined insurance, that everybody pays in and you draw it if you need it. You need certain safeguards. You have to charge them something in order for them not to overutilize, perhaps. But the idea of individualizing things. Let me give you an example of where it works. The collectivizing. That's Social Security. You pay all this money in when you're younger and working. When you retire, you have a pension. And that's a great way to think about healthcare. That's how Medicare works. You're paying part of your paycheck to Medicare. You have this benefit when you retire. And, many people, including Bernie Sanders, believe that's what we should be doing for everyone, not just for people over 65.
Now, this is off the topic. Is there a government pension in America?
There is.
Social Security is what he's talking about.
But isn't Social Security going away? Isn't it
at
risk of going away?
Social Security that you pay into. Is there just a government amount of money? Like my father lives on a pension that the government gives him a certain amount of money each week for just being old. It's nothing that he's paid into. He's money that he's paid.
That's what Social Security in the end that you'll get.
No, but he's still got his money that he paid in. So you could be unemployed your whole life and you'll still get the pension when you hit 65.
Yeah, well, we don't do it quite that way. You generally need to work about 10 years to get regular Social Security benefits. But basically that's it, or you need to be related to someone like the person keeping the house while the bread earner does that. That's Social Security. So it's a little bit different than what you described. It's an incredibly popular program, and it's the thing that keeps seniors out of poverty. Yeah. Most people just don't have any savings, and
what
they
do
have
Americans
a lot of expenses.
Get? What is the pension? What do you get? I know what it is in Australia.
No idea.
It depends on your income. So a poorer person who contributed less doesn't make as much as a richer person, but in a sense, they get a better return on their deal, return on their investment. But I wish I knew that. Maybe the average person would get maybe $30,000 a year in Social Security.
Well, I'm going to get a pension from my TV work because I paid into something, and I figured out that it's basically enough my pension will be basically enough to pay my medical bills. But now that I know when I'm 65, I don't have them anymore. Woohoo!
Well, you'll have some.
I'll be getting up to no good.
Yeah, you'll have some.
Free money.
That's what Tom was saying. Medicaid doesn't pay for everything, but
Medicare.
No, Medicare is older. Yeah, I'm sorry, Medicare is older. Yeah, see, I always get it confused too. Okay. I had some other opinions I was going to say about stuff. It was just me getting angry about stuff about the hospital and people that have cancer and can't even. Okay, anyways. So
I'll tell you the worst: pet insurance. Fuck me.
I have pet insurance on Arnie.
Yeah, how much you pay for that one?
$500 a year. But I've already gotten it back.
Seems like a lot.
No, I've already gotten it back. I've gotten about $480 back this year. And if I was last year, I guess, because it's come. But still, it was worth it because I got reimbursed.
It's not the way to think about insurance. The idea of insurance isn't to make money. It's what Jim said in the beginning. It's protect you. In this case, if your pet has something really horrible happen to it.
I'd like to make
I don't think
money.
it's probably not the right. I don't think it's the right mindset to have.
I do have it because of something like drastic. I've had animals in the past, and then you get there and they're like, this is $5,000. And you're like, what?
Exactly.
And then you're like, well, I guess I'm killing them.
That's the reason to have pet insurance.
Yeah, I used to do that joke. It's like, it's how many years has your pet been alive divided by how many times they've taken a shit on your pillow, and times 100, and that's how much money you spend on them. So,
well, I always think like veterinarians, they must be for people who really, really care for animals, or for people who really fucking hate animals, because I reckon you'd be putting, well, how many animals are you killing a week?
Oh yeah.
Like it wouldn't be like, I saw a lovely dog last night at work, honey. Dead.
They couldn't afford the bill.
Yeah, I do it because I love animals. Dead.
This is a time of the podcast called Dinner Party Facts. We ask our expert guests to give us some sort of fact, obscure, interesting about the topic, this being health insurance, that they can use to impress people if they're at a dinner party or a bar or something like that. I know you said, when I asked you about this yesterday, you said you made some sort of knock on health insurance, like you wouldn't be having anything interesting.
Can I have the 1 to 10 ranks before we start? Can I have the 1 to 10? I just wanted to see
the countries.
Yeah, because you said Germany.
I see what you're saying.
Yeah.
I don't really want to rank them that way, but my favorite were the Netherlands and Germany of the 10 that I studied. The US was my least favorite. Australia, the only problem I have with Australia is that it's somewhat inequitable.
Did Australia beat the UK? Where did the UK come?
So the Australia beats the UK in terms of health outcomes. The UK beats Australia in terms of fairness. Right. And so it depends on how you balance those.
Okay.
And Canada came pretty low because they have...
Canada doesn't do so great compared to a lot of the other countries for reasons I don't know if we have to get into have time to get into the whole thing.
I think they had the long waiting list and stuff like that. I think America is slightly hampered by their nearest neighbor having universal healthcare being Canada. Because I don't know if Canada's the best representation.
They do have long waiting lists there. They don't cover prescription drugs, unlike the other universal health countries, and they haven't been very innovative in terms of reorganizing healthcare. So Canada doesn't rank so high in the
most of their medicine is just strapping a hockey leg next to the limb that you broke.
Oh, I thought it was rub a little poutine on it. That's what they just said. Got cancer, put a little poutine on there. Good. So do you have a dinner party fact?
I do, but I think it'd be more fun if I made it a quiz for the three of you.
Sure. I'm happy about that. Yeah.
Okay. So here's the scenario.
Okay.
You're a mother of 2 children and you live in Texas.
What's my body look like?
You've had 2 kids.
Am I hot like the stretch marks? If I look in the mirror, am I happy with what I see?
Your kids have Medicaid, but we're talking about you, the mother.
Okay.
So how much money a year do you have to make for Texas to say, oh, you're too rich to get Medicaid?
Oh, okay. So you got 2 kids and they've already got it and you want to have it as well.
I'm going to say 23,000.
No, it'd be higher than that because I'm going to say 38,000.
Yeah, I'm going to say 30,000.
It's $3,700.
Get the fuck out of here.
Wait, 3,700?
Yes, it's 17%
Is that a
of
paper
the
route?
It's the 17% of the poverty level. And so if the poverty level for a family of 3, I don't remember, it's something like, $20,000, 17% of that.
This is so
no wonder they
depressing.
banned abortions. Who can afford them?
If you make $4,000, you're too rich. You're too rich to get it. This is Texas. It's one of the 12 states that hasn't expanded Medicaid. If they had expanded Medicaid, she could make probably about $30,000. If you made less than $30,000, she could get it. So that's Texas for you.
So what medical insurance can that woman get for $3,000 something? Can she get anything?
No.
Nothing.
Yeah, no, there's no way.
She goes to the community clinic.
Fun.
I thought that would be sort of a downer way. It was sort of like for a bad dinner party.
No, it's good. No, all of them are upbeat.
No, it's actually, that's a good talking point, really. Yeah. If you're trying to convince somebody that universal health care is a good thing, I mean, that's a great talking point. So,
and it's the Texas legislators and governors are the ones who are keeping this mother from getting the coverage.
Well, that's surprising because Texas normally loves taking care of its citizens. So
especially the women.
Yeah, especially the women. So.
All right, Tom Rice, thank you for being here. The book is called Health Insurance Systems and International Comparison. Thank you for being on the podcast.
Yes, thank you so much.
We had a blast, man. I enjoyed that.
Okay, thanks so much.
To all the people listening to the podcast, if you're ever at a dinner party and someone goes, American healthcare, just go, look, I can't fucking talk about this and walk away. Good night, Australia.